Hi, I'm Dr. Johnson.
I'm Dr. Rill.
We're the chiropractors at Johnson Chiropractic and Rehab here in Catonsville. Today we're talk about the 3 different types of back pain, okay? And what's the first type we typically see, Dr. Rill?
So one of the more common types that we see is more just like a stiffness or tightness. This is going to be usually muscular related, whether the muscles have been overused, whether they've been strained from hard exercise, overlifting, or sometimes from the opposite, being too sedentary, right? We're sitting at a desk most of the day. Things like that can cause some weakness in the core. They're going to have some limited range of motion, stiffness, tightness, those type of symptoms.
Okay. The second type of back pain we typically see is someone who's suffering with a lumbar arthritis, lumbar disc degeneration. That's typically a patient somewhere in the age 35 or more likely 40 plus, and they have wear and tear on their spine. There's loss of spacing of the disc material. There could be bone spurring. It's what we call arthritis or osteoarthritis and wear and tear on the spine. Typically, when someone has arthritis in their spine, it's something they've had for a period of time. It doesn't come on in a day or 2 or a week or a month. So it's typically something that's been there for weeks to months to years, and maybe they self-manage heat, ice, hot shower, motion Tylenol, and they can kind of self-manage it, but then one day it just kind of really grips them and completely upends their life. Would you agree with that?
Yeah, absolutely, I agree with that.
All right, the other third and typically the more complicated type of back pain is what we call a lumbar disc herniation. And in between each vertebrae, we have these discs. And when the disc gets compressed, the disc can kind of push out. And that's when you have the herniation, where this disc is pushing out this way. That will create nerve pressure, nerve irritation, give sciatic type nerve symptoms, where they have pain in the back, pain in the buttock, pain down the leg, feet, and toes.
Yeah, and these are typically your more acute cases of lumbar spine pain. Maybe some type of injury or accident happened, you're lifting a heavy box, kind of turned the wrong way and you get that intense sharp pain. These are going to be the patients coming in with much more acute pain. Like Dr. Johnson said, it could be radicular. If there's enough pressure being put on that nerve, that pain's traveling all the way down their leg. They're feeling significant burning, shooting pain in their leg, and the source is really coming from the lumbar spine or the lower back.
Right. And typically, do these patients get surgery, do you find?
Not typically. I would say most of them respond really well to conservative chiropractic and physical therapy care. It's all about managing the symptoms at first, getting that inflammation down, help getting the pressure off the nerves, and then we got to look at it from a structural and biomechanical sense, and how do we get that pressure off of the nerve for reducing that nerve irritation. Lumbar decompression is one of the best tools that we have to really help decompress the spine, help take some pressure off of that disc and the nerves in the lower back.
Yep. So look, we've covered the 3 types of back pain: muscular, disc degeneration, arthritis, and then lumbar herniated disc. In our next video, we're going to explain to you how we diagnose each one to figure out which type of back pain you are suffering from. I'm Dr. Johnson.
I'm Dr. Rill.
And this is from Johnson Chiropractic and Rehab here in Catonsville.